Recent studies have shown that we are starting more and more as hospitalists to do co-management with our specialty colleagues. It is different than compared to our traditional role in medicine in that we now have shared accountability, responsibility, as well as authority for patients. And this involves practicing a little bit outside of the scope of our practice. Co-managing patients can be a little bit tricky, and frequently it started because we were asked to co-manage patient. It did not start specifically with a plan. But also it can be tricky because not everybody's needs are the same. Not everybody has the same specialty support, for example. So overall, the experts now agree that it is best to write out a plan, and ideally the plan should be written out before you start co-managing patients. But sometimes, and in our experience, it really was helpful to even go back to the drawing board and start co-managing rules or starting devising those rules and writing up those rules long after we had started co-managing the patients. When we write down a co-management process, there should be several steps taken. And again, the consensus is that it should start with specifically delineate the admitting rules. Who will take care primarily, or who will be the admitting physician of the patients. Then after that, you should write out the specific clinical responsibilities and expectations. Specifically, that is very important for nursing staff to know which physician should be contacted for which problem. Then you should make sure that there is effective communication between the different co-management groups, so that there is a mechanism to ensure that patient care issues are effectively translated. Lastly, it's very important that there are follow-up communications to clearly delineate what works well and what does not work so well, and that tweaks are effectively made to the process. Many find that it is very effective and productive to define specific goals, boundaries, clinical responsibilities, and then to track and assess what needs to change. While there is no universal recipe as to what the best mechanism is to develop a co-management program, there are many options available, such as tapping into the expertise of your colleagues who have developed an effective co-management program, as well as from online resources such as from the Society of Hospital Medicine, who have developed white papers and who have a task force that is specifically working on this topic.